Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So, in this lecture, I will be introducing you hemoglobinopathies. Let's get into introduction to hemoglobinopathies. Hemoglobinopathies are group of disorders due to various type of mutation in hemoglobin genes. So these mutations can lead to qualitative defects which will lead to structural defects in a hemoglobin molecule, or it can be a quantitative defects which will lead to decreased or absence of synthesis of globin chains in a hemoglobin molecule. So based on the type of mutations, we can classify mutations in a globin gene as qualitative and quantitative defects. Now, the structural hemoglobinopathies are the ones where a qualitative change in globin will be going on. Examples of structural hemoglobinopathies is sickle cell trait, sickle cell anemia, HBC disease and HBSC disease. And the qualitative defects which leads to insufficient or absence of normal hemoglobin chains, and that includes thalassemia syndromes. And the thalassemia syndromes are of two types. One is alpha thalassemia and the other is a beta thalassemia. So like this, the mutation in genes coding for hemoglobin, especially the globin part of hemoglobin, are classified into qualitative defects and quantitative defects. And furthermore, the qualitative defects usually leads to structural hemoglobinopathies, and the best example to study structural hemoglobinopathies is sickle cell anemia. And the quantitative defects usually will lead to decrease or absence of one of the globin chain in a hemoglobin molecule, and if it is an alpha globin that is affected, it leads to alpha thalassemia. If it is beta globin that is affected, it is beta thalassemia. Now let's look at some of the structural hemoglobinopathies. So a mutated hemoglobin, if it is of S type, sickle type, so in this the beta globin is the one that is affected, and the amino acid residue, the position of amino acid residue that is changed or substituted is the 6th position, where the glutamate, normally at 6th position there is glutamate is replaced by valine because of the mutation. Because of this, there will be decreased solubility of hemoglobin, especially when the hemoglobin gets into deoxy condition, and patient will show sickling process whenever there is a decrease in the oxygen, partial pressure of oxygen, and when hemoglobin gets into deoxy state. So there will be sickling of RBCs in sickle cell anemia. So especially in sickle cell anemia, if both the genes are mutated, so when both the beta globin chain is altered, that is the symptomatic condition which we call it as sickle cell anemia. If only one out of two gene is affected, it will lead to sickle cell trait. And then we have a hemoglobin C type of mutation, again affecting beta chain, beta globin, 6th position, that is 6th amino acid in beta globin, where glutamate is replaced by lysine, and this also causes decrease in solubility and sickling process, and the disease is HBC disease. And coming to hemoglobin E, mutated hemoglobin is of E type, hemoglobin E here, and affected globin chain is again beta, and the amino acid position that is kind of mutated leading to substitution is amino acid 26th in the beta chain, again that is a glutamate which is now replaced by lysine. And the hemoglobin Zurich, beta chain 63 amino acid which is histidine replaced by arginine. And hemoglobin Seattle, beta chain 70th position, where alanine is there, replaced by aspartate. Hemoglobin Hiroshima, beta chain 146th position, amino acid is histidine which is replaced by aspartate. Hemoglobin Kansas, beta chain is affected, 102 position amino acid asparagine is replaced by 309, and hemoglobin D Punjab, beta chain is affected, 121st position amino acid is glutamate in the beta chain, now it is replaced by glutamine. Note that hemoglobin Punjab migrates similar to hemoglobin S in electrophoresis, and it is a severe condition. And hemoglobin M Boston, alpha chain is affected here. Position is 58th amino acid in the alpha chain, where histidine is replaced by tyrosine. So because of substitution in the proximal and distal histidine here, which results in increased tendency of heme to get oxidized to hemine, and patient will show cyanosis. Now, like this, a different type of hemoglobin, structural hemoglobinopathies can be seen. Coming to the quantitative, thalassemia syndromes are attributable to inadequate supply of one of the hemoglobin chain, leading to abnormal accumulation of the other globin chain, which is unpaired, and that unpaired globin chain will lead to inclusion bodies, and that will lead to premature destruction of erythroblasts and the red blood cell, and that's how a thalassemia syndromes will manifest. So lack of having one of the globin chain or absence of one of the globin chain will lead to other globin chain which is normally synthesized to pair with one another and make a inclusion body, and that inclusion body can be toxic to red blood cell. Coming to diagnosis of hemoglobinopathies, electrophoresis technique, that is hemoglobin electrophoresis technique, is commonly used to distinguish normal hemoglobin from a mutated hemoglobin chains. The process is carried out at pH 8.6, at which these proteins are negatively charged, and therefore they move towards a positively charged anode. Now the mutated hemoglobin with change in the amino acid composition of a globin chain will make hemoglobin with a different electrophoretic mobility. By examining the position and relative amount of hemoglobin bands, it is possible to diagnose most common hemoglobinopathies like sickle cell anemia. Hemoglobin bands that are separated in the electrophoresis is quantified by using densitometry scanning. Coming to other diagnostic method that we can use in the diagnosis of hemoglobinopathies is isoelectric focusing. Now this isoelectric focusing, it works based on the difference in the isoelectric points, leading to separation of proteins rapidly in a pH gradient generated by electrical field. And this particular feature of separation of proteins based on their isoelectric point is used in the diagnosis of hemoglobinopathies. So this is the introduction to hemoglobinopathies. Thank you.